We're going to spend the rest of the time talking about esophageal adenocarcinoma, or that type of esophageal cancer that's associated with reflux disease. It's strongly associated with Barrett's esophagus. So what is Barrett's esophagus? The esophagus has a very simple lining to it, and typically when it's injured and it heals, the same lining sort of grows back. In some people, the same lining doesn't grow back. And the types that we see are actually similar to what's in the stomach or what's in the small intestine. When these small intestine-lined cells, now covering the bottom of the esophagus, are exposed to bile and to acid, those tissues can start to change. But as you can see, Barrett's is actually reasonably common, maybe 1 out of every 20, just to take a rough estimate. This is what Barrett's looks like when you look with a scope. Usually, the color of the esophagus is going to be that very pale salmon color, and it's very easy to see the Barrett's esophagus, which is sort of a deeper color, and actually the same color as the stomach or small intestine. So what do you do in a patient who has Barrett's? Traditionally, we've essentially kept an eye on it, meaning that we would bring patients back episodically to take more biopsies and see, is it progressing with regards to dysplasia. What about Barrett's ablation? Ablation means techniques that are used to try to destroy Barrett's lining without using surgery. Electrocoagulation is basically just using like some cautery devices. Argon plasma coagulation is another type burning device using argon gas, which allows you to be a little bit more precise. Photodynamic therapy has been around for about 35 years, and this is a technique where you give the patient some medication essentially to photoactivate certain cells in the body. And then you introduce a very, very bright light. And those cells are going to get burned. Probably the most common ablation technique right now is radiofrequency ablation. All of these techniques where we're burning the esophagus probably ought to be thought of as a way of temporarily managing the problem as opposed to curing the problem.